Dr. Jill Moschelli. I joined MSU Sports Medicine in 2019. I'm one of the team physicians for MSU Athletics. I currently cover women's volleyball, women's gymnastics, and men's and women's track and field and cross country, and women's rowing. I did my family medicine residency at Wayne State University up in Rochester, Michigan, and did my fellowship out east at Maine Dartmouth, and then had my first job out of fellowship was in upstate New York, and then my husband and I had our first son and decided family was really important and moved back to Michigan to be close to family.
Hi, I'm Nate Fitton. I am one of the team physicians at Michigan State as well. And so my background a little bit is I'm from around here. I'm a local guy from Potterville, Michigan. Growing up, I've always been a Spartan. My family had basketball tickets when they were over at Jenison, believe it or not, before they even transitioned over to Breslin. And so it's always been a dream of mine to work at Michigan State. And I did my medical school here at Osteopathic Medicine and was able to do a family medicine residency in Grand Rapids and then fellowship back here at Michigan State, and have been with MSU since 2016. And really just embraced all the opportunities. And right now I take care of women's basketball, men's wrestling, and then some other of the Olympic sports when additional coverage is needed. So our overall goal at MSU Sports Medicine is to be a single location for patients and athletes alike to come when they're having pain, ailments, or even just looking for advice on how to get active and stay active. I mean, our ultimate goal for all patients is to lead a fulfilling, active life. And so we see a wide variety of acute injuries, chronic injuries, as well as people just looking to get active and talk about nutrition, talk about weightlifting regimens and things like that. And so our mission is to provide that service to the community, as well as be a nationally recognized location for patients to come and have access to world-renowned providers that have presented at conferences all over the country, providers with different perspectives like Dr. Moschelli from New York, where it's always important to pull and draw different life experiences. And so we really strive to be a destination for sports medicine and preventative care.
I would just echo that we really are trying to encompass being able to treat everyone. So all ages are welcome and all backgrounds, and you do not need to be an elite athlete to come to the sports medicine office. We just want people to stay active and active in the community. And so you don't have to be an athlete. That's a question we always get. Do I need to be an athlete to come and see you? And the answer is no. We will see everyone and treat everyone similarly. We just want to keep people active and doing what they love.
Well, you beautifully led me into my next question was going to be like, so who should see you? What should happen to them to make them see you? What are some of the common reasons people do come in?
Yeah, so I think Nate mentioned some of that. So chronic issues, something that's been going on for a long time, or the opposite of that, something more acute, something that happened over the weekend. I rolled my ankle, or I was playing with my grandkids and hurt my knee, and something that's new or something that's been going on for years. We can handle all of that. And again, like Nate was mentioning earlier, we can also just give you advice of, I'm training for my first triathlon and I just want to make sure I'm doing things right so I don't get injured. And so those are also appropriate reasons to come to our office. We have in-office x-ray, we have ultrasound for ultrasound-guided procedures and diagnostics. Dr. Fitton is one of our providers who does osteopathic manipulation, and so we really can treat everyone.
I didn't really realize that proactive mission either. That's really cool that you'd rather have people not have to see you, frankly. So
yeah, we get that a lot where patients come in and they're worried that we're going to tell them to stop running, stop walking, and that's not our goal at all. Our goal is to be creative but keep you moving. Maybe running isn't the best thing for you, but riding a bike, doing the elliptical absolutely can be. And it's not that we would totally eliminate things. Like, it's really about being creative and keeping you going, and that's really our ultimate goal. It's I tell patients regularly, yes, if you hurt because your knee was or if you hurt because you run too much and you've got poor form, well, continuing to do that is not what we want for you, but at the same time, we want to keep you active. And so an opportunity to find ways to stay active. Sure, if you just stopped running for 4 weeks, it would get better. but you're going to have other issues for not running. And so we want to find ways to keep you going, keep you moving.
Does someone need a referral from like their primary care physician, or can they just call up and make an appointment, or does it depend on their insurance, I guess?
Yeah, there you go. So we're very open and accepting to any and all patients. Many times patients will call us and even ask, hey, should I be seen there? And many times, absolutely, because we get that fear that Dr. Moschelli mentioned of like, well, I'm not an athlete. I'm somebody who's worked from home due to COVID, and I started to run and my knee's sore. It's absolutely, those are the people we want to see. So you can always call the office and inquire. Now, our staff will check, and if your insurance does require a referral, we'll work with you. We don't just say, you need a referral and that's the end of it. We'll say, how can we help coordinate this? We want your primary care to be involved and aware of what care you're seeking out, but at the same time, we're not going to put all of the onus on you to get to that. We're going to work together because we embrace any opportunity to take care of patients.
I'm wondering if you think there's some exciting new research or treatments on the horizon that have you excited about treating patients better?
I mean, I would say that we are all really involved in sports medicine and are at the cutting edge of what's happening in the field of sports medicine. Many of us are presenting at national conferences and are really involved on a national level with different societies and committees. And so we are really trying to bring that into our office as well. So we really are offering availability to all of the kind of cutting edge opportunities or treatments.
This is where I think we talk about that destination sports medicine. This is where we separate ourselves in that we have the power of a research university right out the door. And so we regularly collaborate with PhD candidates, with researchers on campus that are looking to advance the delivery of healthcare. And so that's another thing patients can look forward to when they come see us, is that we have ongoing research projects. We're looking at things like osteopathic manipulative medicine and the recovery of concussions, and to see if we can enhance or speed up the recovery by adding that treatment modality. Over in the Department of Kinesiology, they're doing a tremendous amount of ongoing research that is really, really at the leading edge of what next level care is going to look like. And so with us being involved in that, we can also provide that to our patients as well. And so I think that's really exciting. And we're looking at emerging things like orthobiologics, which is a term that is out there quite a bit. And what that really means is taking something typically from the patient. And so what we use here is something called platelet-rich plasma, or PRP. And what that is we take your blood cells, spin it down, and grab the healing properties or the healing cells and inject that to a site in order to stimulate a healing response and try and get your body to identify that there's tissue damage, that there's injury, and allow that tissue to potentially regenerate. Now, we talk about drive with scientific research and things like that, and it's evolving. It's not a guarantee. We always tell all our patients this isn't guaranteed to work, but as an opportunity, and there has been some evolving research that is showing support to this, MSU is an opportunity for you to get in and have that treatment option and available because of some of the opportunities here at MSU.
And Dr. Moschelli, this increasingly is an area where more women are getting involved, correct?
Yeah, so I think historically sports medicine has maybe not been as inclusive, but I am very honored to be a part of the group at MSU Sports Medicine. Myself and Dr. Sheba Joseph are two female providers there. And we're both team physicians over at MSU for our athletes. I mean, there are a lot of female athletes there, and they have their own set of challenges that you need to think about when treating our female athletes. And so I welcome the opportunity to see any of our female athletes out there and treat them.
But what would be some tips for the weekend warriors or even regular exercisers to not have to come and see you guys?
So I would say, with regards to advice to the weekend warriors, it's about moderation and approach. When you decide, hey, I'm going to start running or I'm going to start working out, we are in full support of that. Yes, that kind of seems counterintuitive, right? Because the healthier you are, the less you're going to need us. But that's not our goal. Our goal is for healthy, active people. And it really comes down to a strategic approach to getting active and being active. We know that the human body repetitive actions leads to breakdown. And so we regularly encourage diversity in what you do. Don't run 7 days a week. Run 3 days a week. Cycle a couple days a week. Try and get some swimming in. Or incorporate some strength training as well. We know that through activity and interactions that the body can start to have some overuse injuries. And the best way to avoid those is through diversity of your activities, as well as that overall promotes full body wellness and health and strength and things like that. And so that's really the best advice, is that, don't just, it's like anything. If you're going to invest in a company or a Bitcoin, which is not a good idea right now, but you're not just going to dive in and buy a bunch. You're going to do some research, you're going to set a plan, and you're going to work off of that. And I think too often the common issue that we see, and especially with COVID, is I just started running and I never ran before, so I just picked a mileage and I went after it. And so there's a lot of great resources in town here as well as online to have an approach that is logical and strategic, which will set you up for success. Because the one thing we never want to see, somebody that has motivation to do something gets hurt and then loses that motivation.
I think what I'd piggyback off of that is also find something you like, right? So find something you enjoy doing, because one, that's going to hopefully lead to further success in being active. And if you find something you enjoy, and then again, just to echo what Dr. Fitton said about having that cross-training piece, just doing one thing all the time or having your joints move in one direction or one plane, it's good to kind of get them moving in all different directions. And so being creative, and we can help with that as well, about your exercise plan, and including nutrition and including rest days, and talking about how we make you successful.
I wondered if either of you had like a fact about sports medicine you'd want to reinforce, or a myth you'd want to dispel. And I think of our discussion earlier that, sports medicine is only for athletes, and there doesn't have to be. I'm just wondering if there's always been something, I wish people knew this. Or
I think that's a big one, though, is I'll see a high school athlete in the office and their parent comes in with them and they say, who could I see for my knee? Would you see me? I'm not an athlete. And of course, right? And so I think that's a big misnomer, is that in order to go to a sports medicine physician, I need to be an athlete. And that's not true. We just want people to be active and healthy and move in, and we're happy to see anyone.
Over at MSU Sports Medicine, we have both operative and non-operative providers. And so Dr. Moschelli and myself are primary care sports medicine. And so what that means is our background training and residency is in a primary care. So we happen to be family medicine, but those providers can also be internal medicine or pediatric or emergency medicine. And then we do a fellowship in sports medicine. And so our approach is all about the evaluation, diagnosis, management of issues that won't require surgery. And our goal that I kind of look at when I'm treating my patients is to prevent you from needing surgery if I can. And so that's going to be our approach. And we do all things from acute injuries of fractures and ankle sprains, but also chronic conditions. And then we work in conjunction with our orthopedic providers as well for those cases that, despite our best efforts, are going to need surgery. And, the unfortunate ACL tear or meniscal tear, we're more than happy to initiate the care. But what is fantastic about our setup is we have the ability to transition you right to an orthopedic surgeon that has also training in sports medicine right there in the office with us.
Yeah, I would just echo off of that we are a good entry, right? And so if you're not sure who you should see, or if your current complaint is surgical or not, we are a good place to start, because we can evaluate, manage, just like Dr. Fitton was saying, and easily get you to one of our orthopedic providers very quickly. We work in conjunction. That's one of the great things I like about our office, is we're a big family, and we really treat our patients that way too. And so we're going to make sure that you're taken care of. Even if I'm not the best person to be managing that condition, we're going to make sure we get you to the right person.
Just as, and this may be cliche coming from a sports medicine provider, but the team approach to your delivery of care is how that we're going to interact. And so not only are we going to evaluate and manage and make recommendations, if we need to draw upon skills that other providers within our office offer, we're going to do so, and vice versa. Additionally, we would take it one step further. If you need to see physical therapy or another specialist, we're going to help coordinate that. And we're going to coordinate your care with your physical therapist and make sure that everyone's on the same page and we collaborate and work together to getting you back. And so I think that's really the big benefit is our goal is to evaluate and manage. We don't, or rarely do we get someone in the door and say, you know what, we've got nothing for you. I mean, that's a failure on our end. We want to always have an option to help you get better. If it's me, if it's my partners, or someone else within MSU Healthcare or around and abroad, we're going to do that.
I think to just add to that is the communication piece. I think that's the biggest thing of making sure that care coordination happens is we all communicate very well within our group, within physical therapy, within our colleagues within the community. And so I think that communication piece is what's going to drive the best care for our patients.
The MSU Healthcare Sports Medicine and Orthopedic Center is located in the Ide Building on South Hagedorn Road. You can call 517-884-6100 or go to healthcare.msu.edu.
So we have availability to see people now. If you need to be seen for any particular injury, pain, question about your plan, we have openings now, so please give us a call.
Great. And what about the Saturday walk-in clinic?
Yep, we also have a Saturday walk-in clinic that typically follows the university schedule, so it'll open back up August 2022. We see athletes with acute injuries in Saturday clinic. We have our on-site x-ray is there, so we can take x-rays that same day, and our new orthopedic surgeons will also be starting in August, and so that'll be a great way for people to meet them as well.
And again, you can check for upcoming dates on the website healthcare.msu.edu. And Doctors Moschelli and Fitton, thanks for the conversation today.
Appreciate it. Thank you for the opportunity.
Thank you.
And I'm Russ White. This is MSU Today.